OptraGate is a latex-free lip and cheek retractor. The aide's unique flexibility and elasticity make it comfortable to wear and assist patients to keep their mouth open. Before the start of the treatment, select the appropriate size of the OptraGate. The orientation scale with the respective guide marks imprinted on the foil bag can be used as an aid in the selection of the correct size. For an easy placement, with the tabs pointing downward, grasp the thicker and flexible intraoral ring by reaching through the thinner extraoral ring. The inner ring should be held between the thumb and middle finger and pressed together slightly. Place OptraGate first in one corner of the mouth and then in the opposite one. Subsequently, position the OptraGate behind the lower and upper lips. The intraoral ring can be inserted with more ease if the patient's mouth is relaxed. The securely positioned OptraGate improves the overall view and accessibility of the working field. The OptraGate may even be left in place when checking the occlusion. To remove OptraGate, grasp the upper area of the extraoral ring with the help of a paper towel and put it slightly downwards so that the intraoral ring is loosened from the upper gingiva buccal fold. The intraoral ring can then be easily removed from the lower gingiva buccal fold and hygienically disposed of using the paper towel. OptraGate, moisture control made easy.